Okay, with rheumatoid arthritis, there's only a few things that you really need to know to kind of help you understand this disease. So let's talk about those couple things that you need to really understand and kind of key takeaways to help you with the NCLEX. So first of all, understand that rheumatoid arthritis is a chronic and systemic inflammatory disorder, okay? So that's really important to understand, that it's both chronic and systemic. So that's how we'll kind of differentiate it from some of these other types of conditions, is that it's going to be progressive as well as throughout the whole body, okay? It's not defined to just one area. And it can actually lead to weakened joints, dislocation, and deformity. So here's kind of an example of a patient who would have arthritis in the hand here. You can see that it actually leads to kind of like deformity of the hand. So it's this chronic inflammatory disorder of the joints that leads to this kind of deformed look, okay? So again, here's another picture. You can see these joints here. You can see the deformity here in the wrists. So this would be a patient with arthritis. So again, it's inflammation of the joints, and you can see this in all of this patient's joints here. You can see this inflammation. It can lead to the stiffness of these joints. That's why you'll see these patients always kind of complaining about stiffness and sogginess as well. A couple lab values we're going to see. We're going to see an increased ESR. ESR is erythrocyte sedimentation rate. And what that kind of tells us, this is really a lab to help us with inflammation. Okay, so ESR is really it's kind of indicative of inflammation. We use ESR as well as CRP to kind of help us identify if there's inflammation going on in the body, etc. So yeah, their ESR obviously is going to be elevated because there's a great amount of inflammation going on. They also have a positive rheumatoid factor, and that's one way that we can help identify rheumatoid arthritis. And then the joint deformities like we talked about, and they may also experience anemia. Okay, so those are kind of the things we're going to find. The ones I want you to keep in mind here are obviously going to be the positive rheumatoid factor and the elevated ESR, along with, you know, the inflammation of the joints. If you have any sort of question that's asking about and refers to kind of inflammation of these joints and things like that, automatically you need to kind of put your mind going toward rheumatoid arthritis. So how are we going to manage these patients? Well, we want to keep their joints as usable as possible, okay? So for that, we provide range of motion activities, okay? We want to provide our patients an opportunity to kind of move their joints and get them used. We also want to schedule rest times because they're going to be much more likely to be exhausted and tired and things. We're doing heat-cold therapy where we apply a heat pack followed by like an ice pack. We don't want to leave these on for any more than about 15 minutes. Paraffin baths. Paraffin baths are like wax baths. They're little tubs that they can like dip their hand into, and that tub is full of kind of melted wax, and that wax will kind of harden around, and then they can take it off, and that helps with the joint pain, okay? We want to assess the client's reaction to body changes. This goes into like our psychosocial management of our client, so kind of make sure that they're able to, how they're dealing with it, and if they need any sort of help with that. One last therapy we can also provide to our patients is going to be arthroplasty. That's actually joint replacement. So that's kind of like a last resort if the patient's not able to find any sort of relief otherwise. The medications we can give for this are going to be NSAIDs, DMARDs, and glucocorticoids. The entire goal of medication therapy is going to be to decrease swelling and inflammation, okay? And that's what each of these medications are given for. NSAIDs, of course, you know. DMARDs are disease-modifying anti-rheumatic drugs, and all they really do is just kind of slow the progression of the disease, okay? And these are kind of be specific to like rheumatoid arthritis. But we have glucocorticoids as well, which are going to help with inflammation and swelling, as well as immune reactions, okay? So that's kind of how we're going to manage rheumatoid arthritis. If you have any questions, be sure to let me know.